It's a big concern as the coronavirus spreads. Not enough tests to screen everyone worried about their symptoms. Hospitals such as Beaumont begin drive-up screening, but not everyone will qualify. 2 local health systems announced today that they have started processing a limited number of tests in their own labs.
And Dr. McGeorge, that is good news because doctors will be able to get results now we would expect in hours rather than days, which is what it's been.
That really is the goal, and Henry Ford Health and Beaumont Health both made those announcements. Now, the tests that will be processed in-house will focus on hospitalized patients, the sicker patients receiving treatment in the emergency room, and healthcare workers. Tests for the people that are coming through drive-through locations will be sent to an outside lab, so those results, well, they'll take longer. Now, it's important to note, not everyone who wants to be tested will be tested. Right now, the tests are generally being done on patients with the highest risk of serious complications or those at high risk for spreading the virus to people in those high-risk groups. Devin?
By now, chances are pretty good you have heard the phrase flatten the curve, and perhaps you've seen this graphic or some version of it on social media. Well, what does it really mean? This is a graphic representation of our race against an uncomfortable truth. This bottom line here is time. The sideline, the number of patients who are sick enough that they need hospitalization. But here's the problem. It's this line in the middle. This represents the number of available hospital beds in the U.S. If too many people get too sick too quickly, well, we've got a problem like this one. And that's what we've seen in Italy, where doctors have had to make the terrible decisions over who gets treatment and who doesn't. There's not enough beds. So the hope is to flatten the curve by extending the time of the ordeal, yes, but slowing it down enough so that we never see a spike in cases that puts us over our capacity. And public health experts believe the best way to do that right now in the U.S. is what we've come to know as social distancing. Doc, back to you.
Well, joining me right now is Dr. Betty Chu, Henry Ford Hospital's Chief Quality Officer and someone who is deeply immersed in all COVID-19 preparations. So, Dr. Chu, can you talk about, I guess, some of the surge preparations that the hospital systems are making?
Sure, great. Thanks for having me today, and thanks for the work that you do in our emergency department every day. You know more than anybody that Henry Ford and other health systems have been working for weeks to try to prepare. We've been counting ventilators, we've been making sure we have adequate supplies, we've been trying to train our staff on how to handle patients that are coming in with infectious diseases. So we've been really spending a lot of time thinking about how we're going to handle those patients and a surge of patients as they come into our facilities.
And you already have an incident command structure set up, is that right?
That's correct, yeah. We have an incident command structure not only for the system, which I lead, but also every hospital, every operating unit, also our ambulatory setting. We have a lot of clinics, as you know, as well as dialysis centers. We have an incident command structure that encompasses our entire enterprise, so we make sure that we can keep good track of our patients.
Now, as large as Henry Ford Health System is, medical facilities across the nation and, of course, in Michigan are facing some serious challenges as healthcare workers are exposed. Talk about that.
Yeah, that is one of the biggest challenges I'd say we're having right now. We have a lot of nurses and doctors and patients and others that are mingling together. And of course, as you know, nobody comes in with a sign on them that says COVID. So those patients are coming in, we're trying to triage them appropriately, but unfortunately, sometimes our staff and our team members are getting exposed. And that's one of the biggest challenges we're having right now.
Yeah, and ultimately, as healthcare workers get exposed, of course, that puts the whole system at risk of collapsing. And so, Dr. Chu, I really appreciate all the work that you've been doing at Henry Ford Health System, and thank you so much for coming in and sharing your insight on this situation with us. Devin, Kimberly.
Insight. Okay, thanks, Doc. So how did we get here?
It seemed like we've been hearing about the coronavirus now for a long time. It only began as we rang in 2020. It was New Year's Eve in Wuhan, China, a city that long ago aimed to be the Detroit of China. Officials there reported dozens of cases of pneumonia that they really couldn't explain. It took about a week to identify it as a new coronavirus, and 4 days later, it claimed its first life. A 61-year-old man was dead, and it was just beginning.
Breaking news tonight on several fronts on the coronavirus.
China moved with the kind of authority with which they are synonymous, but in our vastly connected world, cases began to appear in Thailand, Japan, and South Korea. And just 2 weeks after the virus had been identified on January 21st, the first case showed up in the United States, in Washington State.
We have seen many cases of clustered infections within families or within groups of friends. who pass on the virus to one another just within a meal time.
The 11 million citizens of Wuhan were now under quarantine orders. Flights, trains, buses, subways, ferries, all idled. But within a week, the virus was being reported in 18 countries. And as February arrived, we also found groups of victims that weren't exactly in countries. They were floating between them on cruise ships, and thousands were quarantined to their staterooms. If anyone needed a central sympathetic figure in the crisis, there was Dr. Li Wenliang. He was the Chinese doctor who tried to warn the world about the virus before it was officially recognized. On February 7th, the virus took his life in Wuhan. He was seen as a hero in China, where the government's ferocious crackdown slowed the progress of the virus, but elsewhere, not so.
No one in the world has ever experienced this virus before. This is the first time this virus has begun to circulate, and it is showing, very significant rates of infectiousness.
True that it was uncharted territory, but confusing takes from the top weren't helping.
We're very, very ready for this, for anything, whether it's going to be a breakout of larger proportions or whether or not we're at that very low level.
Things will get worse than they are right now.
And it did. In quick order, Iran, South Korea, and Italy were all hit hard. And as the global implications began to accrue, the world's financial markets caught the virus too.
There you see the cessation in ticks on the S&P.
America's long-running bull was suddenly changed into a bear. The Dow lost points in breathtaking gulps, and Americans were advised to ignore their 401k balances and try to carry on.
And you see the teams heading back to the locker room.
And yet, carry on to what? Life was changing as events, games, and entire sports leagues shut down. Shelves were suddenly bare of everything from toilet paper to hand sanitizer. And with terrible delays in getting tests available to those who needed them, the problem remained. We didn't know what we didn't know.
With a virus that is that infectious, where there is no underlying population immunity, you would expect perhaps up to 60 or 67% of the population to become infected. That's billions of people.
March 10th was long highlighted on the calendar due to the critical Michigan primary. Highlighted again because that's the night Governor Whitmer announced the virus had arrived in Michigan.
We are taking these cases very seriously and will continue to take every step we can to mitigate the spread of the virus and keep Michiganders safe.
So much has happened.
Do you remember voting in the Michigan primary? That was only 7 days ago. It feels like months ago.
An eternity ago.
Yeah.
You're right. Well, it's a debate going on in so many homes right now. Should you cancel or postpone your vacation? Consumer investigator Hank Winchester is back with tips that may help you make up your mind.
And the stock market roller coaster ride continues daily. Our business editor Rod Maloney breaks down what it means for your money and what may happen in the future.